So this week was the very first Care Coordinator online conference that Peak Health Coaching hosted. We really wanted to do this because we've been involved in training many care coordinators the last 18 months, over 700, but we recognise that this important role is often undervalued in the NHS. And I wanted to briefly share a couple of the key points that came out of this amazing afternoon. The first thing I wanted to share was a pre-course questionnaire that we offered to people, and 54 people responded. And what was really lovely to see was that the majority of people in this job, when we asked them, would you recommend your job to people like you, rated the care coordinator job really highly. There's clearly a great passion and commitment to this role, with the average coming out at 7.8, and the majority of people you can see up in the 9, 10, 8 out of 10 scoring. A few people struggling a little lower down, but generally people love the role. And what they really appreciate is the opportunity to help people and make a difference to people in their role. They also love the fact that it's varied and flexible, but they recognise it's certainly new and evolving. What was interesting is when we asked people, how much do you think your organisation or other colleagues value your role? We were surprised actually how high it came out, nearly 7 out of 10 on average, with a lot of people scoring it 9, 10, 8, 7, really high scores. And people telling us that they had lots of positive feedback from GPs and managers and other colleagues, and obviously from patients as well. And we see that care coordinators are adding this great new facility to the NHS, combining with health coaches and link workers and social prescribing, often to create a whole new capacity that the NHS and primary care has never had before. What was interesting is that when it comes to patients understanding this new role, the scores are a bit lower. And again, we're not surprised by this. This is new, isn't it? Care coordinators have only been out for sort of really the best part of 3 years. In some places, still only just in the first 1 or 2 years. But what the care coordinators did say is that when they explained the role to patients, they really understood it and saw the value of it. So building on the insights from the pre-course questionnaire and across the afternoon, we explore with people what could improve the role. And right at the top comes out this trust and autonomy. People in care coordinator roles are usually there because they have a real passion for helping people, and they want to be allowed to do what they feel right once they get to know people. They've often got more time to hear people out and listen, and that allows them to tune into what the person really needs at the time. Alongside that, of course, they want us to build an understanding of the role in the NHS. The care coordinators really appreciate patient contact. Sometimes they're in quite admin roles, doing searches and bringing people in for reviews, which of course is very valuable. But having patient contact, being able to set up their own clinics, being able to run groups in the community, they really value that, and it adds value to their job. A lot of people told us they're not getting much support and supervision. They're often just being left on their own with very complicated and often quite traumatic cases. So having the opportunity to debrief, offload and build their skills is going to be really important for this role growing in the NHS. And that's familiar across the other person-centred care roles as well. And of course, the other thing they feel is really important is having more local community-based services to connect people to. That value of social prescribing and building the community resources that we have. So to finish up with one last slide, what have I learned from this afternoon about what care coordinators offer to us all? Well, what I see is that there's a level of continuity that care coordinators offer that perhaps we've lost in other places. Myself as a GP, I know how hard it is to make time to see people regularly and to give them enough time. And care coordinators are often giving that continuity of relationship to our most complex patients. That also allows them to join up care. So thinking about the wider determinants of health as well as the medical needs, and make sure people are connecting with all the resources that could offer something for them. And they're able to tailor that to what people need by giving them time to listen and understanding what matters most to you or to them. That's so important. And in doing so, I think they're helping us to improve access, especially to the most vulnerable. I heard a lovely quote, which I'll finish on, and that was one care coordinator that says, "We catch the people that fall between the cracks." And I think that just says it all.